Good evening. I'm Dr. Basil Considine, and I'm here from the ACU Online Writing Center. And today we're going to be talking about how to apply for an NIH individual fellowship. And if you're not sure what that means, don't worry, we're going to talk about that. But we're going to start with the story. So I was teaching at a university in Tennessee, and a faculty person came into my office and said, "Hi, I need help applying for an NIH fellowship." And I said, "Great. Which NIH fellowship?" And he said, "Well, I don't know exactly. I was at a meeting and they told me that I need to be applying for one and that would really change my career." And so I said, "Okay, well, let's get started." And we went on a journey, much like you'll see happening right now. So I went ahead and I loaded up grants.gov. And if you're not familiar with it, grants.gov is a central clearinghouse for identifying federal, which is to say, the US federal government, for identifying federal grants. So if I go to grants.gov and then I say I want to go search for grants, I could do just a keyword search. NIH individual fellowship, great. And you see that actually a great deal of stuff comes up. So while this is a comprehensive thing, this is actually covering a whole lot of different levels and foci. So let's see if we can be a little bit more specific. Now you'll see that we have these are actually sorted by rank. So senior fellowship. So you'll be expected to have done more research, more publications. And we have things that are at the uh, pre-doctoral level for people who are training but don't have a doctorate yet. We have, uh, this is for institutions that don't have NIH funded programs like this. This is for those who do. And individual pre-doctoral was a separate bucket. But where this question came up was from someone who was looking for something as an early career faculty person. So when they'd finished their doctorate, they were teaching, doing research, and they were looking for funding from the National Institutes of Health, not for some larger project just yet, but for something specific to their career. So while this is comprehensive, it's a lot. We can see that we have 526 currently posted results. And even if we trim that down, scrolling down here, even if we trim that down to go by agency and select the parent agency, and we can look through here and see we've got a whole bunch of stuff, but Health and Human Services is our larger umbrella. Well, that's cut it down to 230. That's still more than we want to be searching right now. So we want a little bit more information about the career level. Now compare if we did a Google search for NIH individual fellowships and we see, oh, well, here's one for the National Institute of Neurological Disorders and Stroke, which if that's what you're doing is great. But let's take a look at the second page here. So this is the publication and that the NIH gives for the SF424 fellowships. Now, this is the big umbrella bucket that most of the time when people coming to me are asking about NIH individual fellowships, this is the thing that they mean. Now, there's sub awards within it, but let's find the basic description and then go from there. So we see a lot of, let's say, bureaucratically necessary details here, but not a lot of telling us about what this is yet. But we do get this specific name here. NIH and HRQ individual fellowships. So if you see this, then you know, oh, there are two umbrellas where the fellowships funded through this are coming from. And from that, we can see a more specific way to go. Also, if we jump back to our search here, where we went to grants.gov, we could also enter in that instead or in addition to it. So we had SF424, which I mentioned was the main designation here. If we search for that, now we have a much more concise 14 results. And looking at this, we can see that these are actually separated by entities within Health and Human Services, that's HHS. If you just joined us, we are talking about the process of identifying specific NIH fellowship opportunities relevant to one's rank and position. Please feel free to type questions or specific requests in the chat room because I would rather customize the space to what you're interested in, what's relevant to you, rather than talk about things more generically or some examples that aren't as useful. Now, if we look at this, we see that there are some things that perhaps we're not so interested in right now. And with the particular thing that we're talking about, okay, well, these things looking about building programs, perhaps less of interest to us right now. And we might say, okay, well, the fishing part, yes, technically there, but we're looking for the individual stuff. And so, because again, we have a lot of results here, let's narrow this down a little bit and say, okay, SF24 fellowship. All right, now we have a slightly wider bucket here, which is fine. But let's look at the requirements for eligibility here. So we have, on this, we have the entities that can apply for it directly. But if you're looking at this for your own part, you're probably more interested in the individual side. And so this is where we see that these things that we're looking at right now are grouped in sets. So let's now dive in and take, for our purposes here, let's say you are completing a doctoral degree in speech pathology, and you say, well, the next step is going to be I'm going to work in audiology. Actually, let me revise my example. Let's say you're getting your master's in speech pathology and saying my next step is to do a degree in audiology. Great. So we can see that there, for certain disciplines, we have these dissertation fellowships. They're designed to let you do the research, publish, and use that as a cornerstone of your doctoral program. So this is the lowest general level for NIH fellowships. Now, if we're looking at the eligibility requirements, we have this more detailed guide, but we can see that they are actually quite general about the exact type of degree because some universities, they do grant an AUD, sometimes a PhD in that, sometimes it's a doctorate in biomedical sciences with a specialty in audiology. So it matters that it's a doctoral degree and that it is oriented towards this product here. And we could look at that more if people are interested. But let's go back and look at the next level here. So we have, this is pre-doctoral because it's for a dissertation fellowship. There are also things like this one here, which is an individual pre-doctoral fellowship. And we can see that there's a wide variety of categories in which it goes because medical research, healthcare research, very, very broad. And so we look at this and see that there are institutions, you need to apply through the institution. And this is where people usually get tripped up on these things, where they say, well, hold on, I want to get it, but I can't apply directly. And for many of these NIH awards, what you actually need to do is apply through your institution because the institution is allowed to nominate up to a certain number of people per year. And so for this, you want to know who is the director of your Office of Sponsored Programs or equivalent research office that deals with those things. So you'll note that it says to enable promising pre-doctoral students, so not having completed a doctorate yet, to obtain individualized mentored research training from outstanding faculty sponsors while conducting dissertation research related to those umbrellas. Now, that's pretty broad. And you can see, for example, if you were in our DMP program, this is something that ACU could apply for to get funding for students to work with research mentors who do have doctorates who are on the faculty. And so actually, many of these programs at different universities have been initiated by students saying, hey, we would like to have access to this. We would like to work with you, our faculty and administration, to apply and get that out there. And because these buckets are so broad, it really helps if you have a specific focus or set of things within there, because then it's writing a common application for funding for multiple students. All right, so that was student level. Let's back up again. Now, we also have postdoctoral, and you're going to see a lot of things that are similar here, where we're looking at, again, a broad group of disciplines within the larger NIH umbrella. We'll see that the applicants should be entities rather than individuals. And we see again that it is designated towards allowing in research. In this case, it's highly promising postdoctoral candidates who have the potential to become productive independent investigators. And this is what I was talking about in that first case, where a newly hired faculty person had just finished their doctorate the previous spring, defended, graduated, and come to join our faculty. This is what he was being advised to do. Because if you have just finished your doctorate, usually most of your work has been focused on the doctorate. If you tried to apply for the senior award, they say, well, you haven't done any of those things yet. But this is to do research not as part of a clinical trial, but to start doing work that might lead there, perhaps eventually, but you have something related with a sponsor, a mentor. Could be a chair, could be a senior faculty, could be someone in another institution. But if we zoom in on this, we see, all right, we have again the broad NIH umbrella here. We have many details that we'll skip because they're there for the federal tracking. We can see that this has been running for some number of years, and that this particular cycle, the last submission is going to be in August. Now, that's great if you are starting at a university that doesn't have this program yet, because that's a couple months of lead time to get everything signed and dotted and get people a degree to be mentors and things like that. But let's see what's required for the application. But first, let's read this announcement or parts of it. These fellowships support the training of pre- and postdoctoral scientists, dual degree investigators, and senior researchers. Dual degree is usually referring here to MD, PhD students. And we see that this is designed in part to give you the foundation to support working in their mentored postdoctoral training under the guidance of experienced faculty sponsors. And so this is about creating the conditions to prosper. And these are normally 3 years, 3-year awards. So that's great. Must be a minimum of 2, can be up to 3. Very few people apply for less than the full 3 because it makes it easier for someone to commit to that. And we see that, it's a one-time thing. If you get it, they expect that the next time you're applying, that you will be eligible for a higher level of support. We have a little bit more detail here. If you're curious, yes, I have seen people with Doctor of Nursing practice degrees get this award, or have one administered to them. Yes, I have seen people with the PhD in nursing science do that. That's more, does the rest of your application or the institutional application support that? All right. So looking at this, we see that there are some general guidelines, but nothing super specific on this page. But if we jumped over to here, we'd find that they have a whole bunch of stuff about what you can include, including, it makes me happy to see childcare costs are something that can now be covered as part of these awards, which is great if you want to have people who are parents involved. Having someone to look after the kids so they can focus on the research is really helpful. And just to see what some of the things are involved, you can trace through this to find what the different stipend levels are. All right, so if we move back here, we can see that, all right, there is an application process. if you're reading this, you're probably interested in your institution of higher education applying for you. There are freestanding research institutes that can do it. They generally are like think tanks and laboratories and things like that. And unusually, it's also available for for-profit organizations and even entities that aren't the NIH and within the federal government. And that's pretty neat because if you are working for an organization and in a research capacity and you've recently finished your doctorate, you can have them apply for this to help keep you there. And so a number of people who've done projects as a graduate student, their institution has gotten funding and to keep them there in a postdoctoral capacity. All right, now some of the caveats here. It does take a while for these different federal approvals to take place. The SAM award registration, that's usually takes about a week in my experience. But some of the other things, it does take a while. So start early, and you can always get those things set up while you're still writing the rest of the application. Now, you need a program director or principal investigator, the PD or PI, and they need to have their Era Commons account. Um, and this is something, if they don't have it already, they need to get that set up. Same thing, they also need to have their ORC ID. The ORC ID is a unique identifier to associate you with the research. Many senior scholars have not signed up for these or haven't associated all their articles with it. I would really recommend it because it's now being used as part of the approval process, and often we'll have a graduate assistant or research graduate who's working with their PD to get them set up because it may not matter to the PD, but it matters to the person who needs the PD to be registered in there to get this going. All right, now if we look at this here, we have a wide list of potentially eligible doctorates. And I wish to point out here that it even says that this is not an exhausted list, but they want equivalent doctoral degree. And we have, among other things, Doctor of Osteopathic Medicine, Engineering Doctorate, Doctor of Public Health, Doctor of Nursing Science, PharmD, Doctor of Social Work. So a doctorate, so long as it's relevant to this thing and falls under one of the NIH umbrellas for research. And it's supposed to be a full-time thing. And so if you were, say, MD, PhD, the expectation is that you wouldn't be seeing lots of patients, you'd be working at least full-time equivalent. So let's say 40 hours a week as a ballpark doing the research. And there might be a little bit of clinical stuff you do related to it. Maybe you're interviewing patients, enrolling them in a study, but the focus is you should be doing research if you're funded through this. Now, I mentioned that this is going to be applying through the institution. And so it's important to identify someone who meets the qualifications here, which so usually the program director is going to be a senior scholar. Often that's the department head, not always. Someone who has published a lot and has a track record of successful mentorship. A great place to jump on this is when you have a new faculty person, a new senior faculty person arriving for another institution. And they make a great person to be the sponsor because of their prior record and because they're not engaged in sponsoring other people yet. All right, so let's talk about some of the other things. So there's a very detailed application guide, and they are absolutely serious on their page limits. Let's just look at this. I was at a training with an NIH representative who was mentioning how many applications they were basically tossing out because they exceeded the page limits on things, and it was a lot. So we can see that we have specific page limits. Okay, don't go over that for the project summary. If you need help condensing that summary, come to the Writing Center. We can really help with that. Project narrative, just 3 sentences. Again, happy to help with that. And then usually what I recommend is write all the things that you think are important first in an outline form, and then that will give you an idea of how much to expand the bullets in the outline for each of these. Now you're limited to 6 letters of support. So my recommendation is keep the recommendations at 1 page each, because then you can have 6 different ones there. Because you can have 6 pages of plans and statements, don't submit 2 pages, go for something that's close to 6. And this is really just saying you've done that, you've done your prior diligence, you've done your IRB trainings and things like that, but you want to make sure you have it there. And the things that usually will trip people up are these letters of support and this stuff from the institution. Biographical sketch, I will tell you, I've had some, the day it was due, people coming in for work on the biographical sketch. Please don't wait that long, but it is something that can be written relatively quickly. So long as you have the rest of your details together. This is a great one to give someone else your CV and ask them what they would write or highlight, and then start drafting something up yourself. If you're wondering what the time burden is for this, well, I was again at a training by an NIH presenter on this, and he said, you should budget a week of time to getting this in. But a week preparation for what could be 3 years of funding is not a bad exchange. And you're not limited to applying once. Many people who don't get in the first time get it funded the second time around. So that's coming from NIH, not from me. Apply a second time. Usually what happens is that that there's a section that you're rushed. Perhaps you're missing your co-mentor, so you only went with one of the mentors you had planned. Maybe someone didn't get one of your letters in on time. So plan that in advance. Now, I would also take this and use this to make a task list. For example, you can take these different items and put them in a spreadsheet and break them down so you have your individual letters, and you can track what do you have this yet, when to send a reminder for that. And when you're requesting letters of support, tell the writers the kinds of things that you would like them to write, give them examples they can draw on, provide them key dates and other things like that. For example, I took your class from X to X, or we talked about these things that would relate to your research. Here are some of my strengths. And so if this sounds like you are providing the letter writers information to write about you, yes, that is entirely what's going on. You are making it as easy as possible to write a strong letter, because usually if someone's being a senior research mentor, they are rather busy, and you can help them write a good letter quickly and efficiently by preparing that. Now, some writers will tell you, just write the letter you want me to sign, and I'll look at it, might make some tweaks, and then I'll sign it. Great. Make sure you write a strong letter for yourself. And the best way to make a strong letter for yourself is to have specifics that clearly align with the project that you're applying to do. Okay. Now, if we jump back here, we see that there's some stuff for institutional training. So make sure you're looking at the right thing, because you're probably applying for career development and not applying for the institutional training right now. Now, if you're a chair and you're trying to do a big umbrella for that, maybe, but make sure that the application code that you're looking at matches the one here, because there are some key differences in the size limits. And I had one chair tell someone, I can't write 25 pages. And it turned out they were looking at this checklist instead of this checklist up here. And you can see that's much more concise, a 1-page description of the institutional environment. Great. And another reason to reach out to the Office of Sponsored Programs or Office of Sponsored Research, or whatever it is called at the institution you're at, is that often they have these things prepared, because they are the central clearinghouse for the institutional applications for these grants. So that if they have text that they wrote for the last time they had something funded like that, awesome. Okay, let's back up here and we're going to go back to our searches again here. So let's start at the very beginning here. Again, we're going to search for individual fellowship. All right, 386, that's far too many. We want to cut that down so we can look at categories and we can select health. Great, that drops us to 99. We want to be more specific. All right, well, we saw the Health and Human Services, HHS. Great, we could go and select that. All right, we're at 85. Awesome. So now let's say you're looking at this and you're saying, well, I just got hired for something starting in the fall. I'm not going to be doing any work on that for the summer. So you might say, all right, let's sort this by the close date and say, all right, I'm going to skip past all that stuff that's due in May of this year. And August is, I'll just be doing my faculty orientation. That's probably too soon. And say, okay, wait, hold on. Mentored Research Scientist Career Development Award due in November. Oh, this is looking doable. And say, okay, this is a specific one that interests me. Let me see if I'm or my institution meets the qualification. Why, yes, we are a private institute of higher education. Great. And we see that health services research needs, great, nice and broad. And we can look at that specific notice and see, okay, it's technically offered through the AHRQ, not NIH. That's okay. Close enough. Same SF 424. And we see that we have lots of details. We can look into it and ensure a diverse pool of highly trained scientists. Awesome. So this is a very broad bucket. And we see that we have uh, not two different organizations. So we have a detailed description, talks about the details for what you submit. And here's an important thing. It will contribute up to 90 grand in direct costs per year towards the salary of the career award. So if you've been hired as a, uh, let's say, a non-tenure track faculty at a research institution, and you bring in, oh, I've got 90,000 now to fund the research that I'm doing because I'm mostly teaching, and this will let me have a large research component. And great, you have now funded much of your own position. And you can see why this could be very appetizing for a program to sponsor you in an application like this, where the funding will directly underwrite a large portion of your salary. So, and it's not just your salary. It's when it says fringe benefits, that means that among other things, the institution will get an extra percentage to cover their costs, and that you should get proportional benefits according to the compensation there. So, if there's a certain contribution to your 401k, that's generally going to be matched. All right. Now, if we look at this, we see that this particular one, we have a number of different things there. So there's a salary, but also like research budget specifically, like for hiring graduate assistants. So it's a lot more than just that salary thing. And again, the institution does get some money out of this. They get 8% of the modified total direct cost. So if that's 90 grand towards your salary and 25 grand in research funding, that's going to be, around $9,000 for the institution, which is a great incentive to give you some assistance on the application. And so this is one of the reasons that if you're contact a research office, they have people who can help you if you come to them early enough. Now, I would say get in as soon as you can, start the conversation, because you want to know what they can help you with, what they will provide, what their internal deadlines are. And that's all good stuff to help you plan and know what you can get assistance with on that. Notably, this does not require cost sharing. So many federal grants require that the program put up a certain amount of money. No, there's no cost sharing. You just have to be uh, employed there, get them to apply for the funding, get that mentor, etc. Now, interestingly enough, we have many people who are junior faculty at more than one institution. Sometimes it's adjuncting at one, sometimes you have two adjuncts. But to accept the award, you need to have a full-time appointment somewhere. And yeah, it says normally defined as 40 hours, but usually there's some compromise that people do adjusting in the light of the outside funding. Now, I want to point out here that you can have separate applications for the same person being reviewed, because sometimes you're doing work for more than one place, and either place will bump you up to full-time if you get the award through them, or they'll guarantee full-time up to a period of time, and then full-time after that will be contingent on your getting the award. So there's sometimes some negotiation there, but I know plenty of people who went from part-time to full-time through getting one of these awards, and they funded the research lab through the research support portion. Very important, make sure you identify a mentor who will supervise this. And you are here required to work with the mentor. So mention that up front that you need them to be working with you, and try and quantify that in terms of time so they know when they can budget that and whether they can reasonably say yes or no. Okay, if we were to look at the rest, we see that it parallels the sections we were looking at in that earlier thing, but we have this outline here. So this is essentially a task list for what you should include in the order that you write it. And so all these things should be laid out. And with that, I'm going to say, make sure that, again, that you have strong letters of support and give people what they need, what they ask for, what will be helpful to write that. And if you're doing that, you can work on having your set of recommendations be complementary. That is to say, saying related things that together create the full picture and are not just all repeating the same thing. Okay, I think that's a good pausing point for today. So let me go ahead and stop the recording, and then you can ask any additional questions. But before we wrap things up, I do want to again say that at the ACU Online the ACU Online Writing Center, we are happy to work with writers throughout the ACU Online community at any stage in the process. You can always send us an email at onlinewritingcenter@acu.edu with a quick question. But if you want detailed feedback, go to my.acu.edu and select the groups page, select the Online Writing Center from that, and you can see all the information about making an appointment. We can do email appointments where you sign up for time, send us your stuff, we look at it, send you feedback within 24 hours. You can also sign up for a Zoom appointment. If it's something that's particularly research related, tell us the particular opportunity that you're interested in. So you can certainly go ahead and share the link to the instructions that you're looking at. And I would encourage that, because it helps us know the standards that you're going to be graded by or evaluated towards. So with that, I'll say thank you for joining us and have a good night.